Today we'll be discussing about low libido or hypoactive sexual desire disorder. So please listen to it as I'll be bringing you about from Mayo Clinic regarding this. Have patience and listen.
Clinic Radio, I'm Dr. Tom Shives.
And I'm Tracy McCray.
Well, the FDA has just approved a new drug for women with low sexual desire disorder, low libido. And here to tell us about it and to talk about over-the-counter products that claim they'll help women with the symptoms of menopause is women's health expert Dr. Stephanie Fabian.
Dr. Fabian is the medical director of the North American Menopause Society and the Bill and Penny George director of Mayo Clinic Center for Women's Health. Welcome back to the program, Dr. Fabian.
Oh, thanks so much. I'm delighted to be here.
Impressive credentials. Glad to have you. So let's talk about this new drug.
You were just about to call it female Viagra, weren't you?
No, I was not. Of course not. Bremelanotide, is that how you pronounce it? And it's the brand name will be Vyleesi. Vyleesi,
yes, and it's bremelanotide. That's correct. It's basically one of those brain neurochemicals that affects desire in women and in men, as a matter of fact. But it is one of the excitatory chemicals that in our brains. We also have inhibitory ones. And so whereas the last drug that was introduced to the market affected different chemicals that affect desire, this one is focused on melanocortin in the brain, and it's working on that to presumably increase desire in women.
Do you think it'll work? Does it work? Have the studies that have been done so far show that it's efficacious?
The studies have confirmed that it increases sexual desire and decreases distress associated with low desire in women. Women also were able to fill out a question about whether or not they felt it was beneficial to them, and they did. So yes, it has been determined that it's efficacious. It does have a few side effects. So about 40% of women had difficulty with nausea, and about 20% had difficulty with flushing. And the other thing to note is this requires an injection, so it's given as needed for low desire, not taken every day.
And how long does it last?
It lasts about 45 minutes or so.
Wait.
No, wait, I'm sorry about that. It lasts much longer, a few hours, but you have to use it 45 minutes before you want to have sex.
So you have to get a shot before you're going to have sex, 45 minutes before you would like to have sex.
That is correct.
Can you give it
inject
to yourself?
Yes.
Really? So you mentioned female Viagra, but it works differently, correct?
It does. It's different brain chemicals that it's working on.
And Viagra works on blood vessels. So it's
Yes, Viagra is not a female drug, and it works on blood vessels.
I think that's...
Let's leave the guys out.
Well, we were talking about that, to call it female Viagra isn't fair to either drug because they're two completely different things.
Entirely different things. And the two drugs that are on the market, flibanserin and bremelanotide for women, are not affecting blood flow. They are affecting the brain chemicals that affect desire. So it is not a female Viagra, and it's not accurate to call it that.
So what happened to the drug flibanserin? We talked about it a couple of years ago. It came on the market. What happened to it?
It's actually still there, and I believe the company is planning on doing a relaunch. It is difficult for women to get it right now, primarily because it's so expensive.
And wasn't the other problem is that if you were going to take it, it's a daily drug, as you mentioned, but you couldn't drink alcohol. And so some women didn't want to take it because of that?
Well, that is true, although that has changed. The FDA did put out another release in the last month or so that said, indeed, you can drink alcohol. You just can't take the pill within a couple of hours. So that means you have to wait till after 9 o'clock in the morning to take the pill.
Is it true, though, that you had to be an approved or certified healthcare provider in order to write a prescription for that drug?
That
Addyi?
is true, and that is still the case. So as a provider, I have to be certified, and the pharmacist who is dispensing the drug has to be certified to dispense it.
Let's talk about the new drug, Vyleesi. Who is it for?
So it's for those women with low sexual desire that we can't really identify any other treatable cause for. So that means it's not for the woman who low desire is related to a medication or it's related to a relationship issue or it's related to vaginal dryness and pain with sex, that's not going to fix that, right? So this is really, we've gone through the list and we haven't found anything else that would cause that low sexual desire. It's also for women before menopause, not for women after menopause.
Why not after menopause?
It just wasn't approved in that age group yet, and I'm sure it's because the FDA felt like there was not enough study done in postmenopausal women, so unfortunately that leaves out a big group of women who still have issues.
People who might be interested in that drug.
Right. Yes?
Explain to us a little bit more about how you exclude other causes of low libido before you would prescribe this drug.
So when a woman is in our office and we're really kind of going through this, it takes some time to figure out if there are other causes. So there's the biological causes that could be a medical condition or a medication that they're taking. There's the psychological causes that are things like not feeling great about your body image issues, or substance abuse, or a history of abuse, or anxiety or depression. Then there's the sociocultural category, which is sex education, how your family of origin taught, what you heard about sex as a family. And then there's also the relationship category. So how good is the relationship? How good is the communication? Are the logistics even lining up? So after we've gone through all of that, if there really is no obvious cause for low sexual desire, then we say it's probably just a biochemical thing.
You mentioned earlier about the distress that low libido, I think that's the word that you used. There's 8 to 14% of women who do have this problem. And is it really bothersome to a fair percentage of those women?
As you indicate, it does vary between about 8 and 14% of women, but this is really distressing. So it's not just the woman who says, yeah, I have low sexual desire, but it's fine with both my partner and I. This is the woman who says, I feel guilty about it, I'm disappointed, I feel a sense of loss or a sense of grief about lack of desire, and is ruining my relationship. That is the woman that we really need to focus on.
And you would then teach the woman how to give herself an injection? Do you do it in the thigh or the arm, or we don't know yet? Somewhere, huh?
I am not that familiar with how this is administered yet because I haven't prescribed it yet. I think it will be out in the next few months. But yes, I believe it's administered subcutaneously. I'm not sure where.
All right, but you're optimistic about how effective it will be?
You know, I think it will be an answer for some women, not for all. And again, the more choices that we have for women to deal with distressing sexual problems, the better. And the more attention we bring to this, I think that having a conversation is a good thing. So the fact that this drug is allowing more of a conversation about women's sexual health is always healthy.
All right, we're talking with women's health expert, Dr. Stephanie Fabian. There's a new drug for women with low sexual desire disorder, recently approved by the FDA. It's called bremelanotide. Bremelanotide, also Vyleesi, right?
Yes.
That's the brand name.
And I found it's administered in the thigh or the abdomen 45 minutes before sex.
All right, bremelanotide acts on the brain receptors. It should be available in September. We don't know how much it will cost, right? And we don't know whether or not insurance will pay for it. That's
unknown
we'll
yet.
find out.
It's time for a short break. Coming up, we'll talk about some over-the-counter products that claim to help with the symptoms of menopause.
Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
We are talking with a women's health expert, Dr. Stephanie Fabian. We've talked about a new drug that should be available in September for low sexual desire in some women, premenopausal women. Let's turn the tables and talk about postmenopausal women, because there are a lot of women who experience symptoms when they reach menopause, and there are a lot of over-the-counter options out there that claim that they will reduce the symptoms, whether it's hot flashes or night sweats or depression or sleep disorder, etc. Are there some over-the-counter options?
The broad answer would be not really, unfortunately. So there are many things out there that are marketed for hot flashes and night sweats in postmenopausal women, but we don't have a lot that are really proven to be effective in scientific studies. The one exception might be a derivative of isoflavones or soy, and that is called S-equal. There are some promising studies in that, but I would say it's even really too early to be wholesale marketing that one for hot flashes and night sweats. So no, the landscape on the herbal supplements and vitamins and that sort of thing is kind of underwhelming at this point.
What about when it comes to what we were talking about earlier, low sexual desire for postmenopausal women?
Over the counter? No.
Nothing.
Yeah.
Absolutely nothing.
No. And don't waste your money on it.
Excellent.
Now, what about there are some celebrities, in fact, who are touting bioidentical hormones for menopausal symptoms?
Boy, that is a sticky question. So the first part of that is, what does bioidentical mean? Bioidentical just means it's chemically, structurally the same as what your body used to make. And when we're talking about estrogen, that is estradiol. And when we're talking about the progestin or progestogen part of it, it means it's real progesterone. So bioidentical can be compounded, which is what we're talking about here. These pharmacies and some of these celebrities are touting. And what they're touting is that these products can be customized just for you. And there's a bit of a myth there. So these products are also available in FDA-approved products in your local pharmacy, and the FDA regulates them, so we know that what is in the bottle is actually what's on the label. But the other thing about this is we don't really know what level or dose of hormones is going to work for any one woman. And so saying that everybody has to have the same blood level or saliva level is inaccurate, because we just don't have evidence to say that that's where your symptoms are going to go away. So there's also concerns about purity and potency. So batch to batch variability. So 1 month you might get something in the bottle that's got one strength, and the next month it might be different. And they've actually done studies to measure this, and the amounts in the bottle are all over the place.
Ooh, so that is, so don't waste your money on over-the-counter remedies. And there's a lot of question about the bioidentical hormones.
Well, the custom compounded variety. We do have FDA-approved bioidentical hormones, and those are the ones that we typically prescribe.
So hormone therapy for postmenopausal symptoms.
Correct.
But isn't that still controversial?
No, it's not controversial anymore. The hormones are safe and effective, and they're the most effective treatment for women who are having symptoms, who are younger women who are in their 50s within 10 years of their last menstrual period and having bothersome hot flashes and night sweats. This is not controversial anymore, and for the large majority of these women who are healthy, they are good candidates to use this, and it will reduce their symptoms by about 90 to 95%.
I think when it comes to over-the-counter, the medication that I hear most often from women in my age group is Amberin. What do you know about that over-the-counter medication?
You know, before we had this discussion, I knew nothing about that medication, but actually...
Thank goodness we told you we were going to ask.
Right.
Because it's advertised. We listen to AM radio.
You are much more informed than I am.
But it's advertised on there all the time.
Isn't that fascinating? Because looking at the ingredients, there's nothing in there that would really help with hot flashes. So it's kind of shocking that that we can have false advertising like this in the United States, and there's really is no evidence that the ingredients on that bottle would help you with hot flashes.
To the better point then, is there anything harmful in that drug?
No, probably not.
Because
maybe to your wallet.
Well, to your wallet, exactly. For some people, I say, if you want to take it and if you think it's helping you, then keep rocking on, because you're trying to get rid of these symptoms. If they go away when you take this, as long as there's nothing that's hurting you in there, I don't know what the problem would be except for the money. Lots of money.
Here's the interesting fact that any hot flash treatment that we've ever studied has about at least a 30 to 40% placebo response.
Effect.
Yes.
So that means that you can take a sugar pill, and if you think it's going to make your hot flashes better, guess what? It probably will.
Nice.
Now, I thought, let's go back to the hormones, because I thought the Women's Health Initiative study that came out a decade or so put the kibosh on prescribing hormone therapy for women, postmenopausal women, because of the potential side effects.
We have come full circle, And we are back around to the beginning. And when they finally, in the Women's Health Initiative, which came out in 2002, I know time flies, but when we came back around and finally looked at the women in their 50s specifically, it turns out that everybody agrees the benefits outweigh the risk for healthy women who are having symptoms. So it probably has a beneficial effect on the heart. It definitely helps bones. It helps your hot flashes and night sweats. It's probably neutral, possibly helpful with regard to dementia risk. The main concern remains the breast cancer risk. And for women without a uterus who have had a hysterectomy, there is no increased risk of breast cancer. It's the women who have a uterus and have to take the progestogen with the estrogen to protect that uterine lining that there's a slight increased risk of breast cancer. And when we say slight, we're talking 8 to 9 extra cases per 10,000 women per year after about 5 years of treatment. And that's about the same as between 1 and 2 glasses of wine a night. It's about the same as being obese, and it's about the same as being inactive.
And you call it hormone therapy now. You don't call it hormone replacement therapy because you're not trying to replace what the hormones that they used to have.
You're exactly right. We are just trying to control symptoms. We are not trying to make you 25 again. So we're not trying to give you everything that ovary used to make back. We're just trying to manage symptoms.
You are the medical director of the North American Menopause Society. Congratulations.
Thank you.
What does that mean to you? What do you hope to accomplish in this role?
Well, it's a new role for me. I just took this on last week, as a matter of fact. And I think, it is the premier medical society in North America for midlife women's health. And I think if we can figure out better ways to treat women in midlife and prevent the consequences of aging and help women live healthier lives, that would be the goal. We have a great membership, and I think in the future we hope to bring more education to providers, but also to patients and women out there in North America.
What about the idea that you have to battle through menopause instead of, and now that I'm gone through it, I just think there's so much in the way that we talk about it, instead of it's a part of life that you experience, instead of the detrimental side of what it does to you. There's a lot of bad things that you don't enjoy as you're going through menopause. But I've really noticed the way that you think about it and talk about it makes a huge difference.
You're exactly right about that. And I don't think we have enough conversations, and it shouldn't be seen as a disease process. It really is a phase of life. But there are a lot of potential health consequences that come along with going through menopause. For instance, our heart disease risk goes up to that of men after we go through menopause. And so it's a time where women really should feel that they can take their health into their own hands and be proactive about healthy aging. So I think you're right. We need to shift the conversation a little bit to how do we age in a healthy way rather than menopause being the beginning of the end.
We need an update before we finish on the HPV vaccine, because there have been some new recommendations, right? First of all, tell us what the vaccine is for and the new recommendations.
So the vaccine is for human papillomavirus, which is the virus that can cause cervical cancer in women, but also penile cancer in men, so it doesn't just affect women. But the vaccine changed. The CDC has now recommended that it used to be recommended up until the age of 26. In both boys and girls, and now what it's done is extend that to the age of 45, so that individuals who haven't been fully immunized up until that age can talk about it with their medical providers and consider getting the update to get the vaccines and get covered through that. So there really is little to lose. This is a cancer-preventing vaccine, and it's the first one that we've ever had, so really there is little downside, except it may take insurance coverage a little time to catch up with this new recommendation.
And not to forget that it also can cause throat cancer in both men and
throat
women.
cancer is really increasing too, so good point.
Dr. Stephanie Fabian, Medical Director of the North American Menopause Society and Director of the Mayo Clinic Center for Women's Health. And by the way, Dr. Fabian's book is called The Menopause Solution, a doctor's guide to relieving hot flashes, enjoying better sex, sleeping well, controlling your weight, and being happy. How can you not buy that one?
You gotta love him.
Available on Amazon. Dr. Fabian is optimistic about the new drug for premenopausal women with low libido, and that should be available in September. For postmenopausal women, it's important to now know, and we know from one of the world's experts, that most over-the-counter remedies for the symptoms of menopause are not worth the money. But there are effective, legitimate options. And finally, the new HPV vaccine is approved for men and women up to the age of 45. Dr. Stephanie Fabian, thanks for all the valuable information.
Thanks so much for having me.
Thank you for watching. Have a great day.